Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I am the Family Wellness Chiropractor and the Wellness Care Coordinator here at Cap Wellness. And today we're going to have an amazing discussion with Dr. Capetanakis and Care Messer about birth education and about why it's so important for a healthy pregnancy as well as for a healthy birth. But before we start, I want to take a moment to thank our sponsor, the Cap Wellness Center, who makes this podcast possible. The Cap Wellness Center in Encinitas, California has assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal and postpartum wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And now I'd like to introduce to you Dr. Capetanakis and Care Messer. Dr. Capetanakis is board certified by the American Board of Obstetrics and Gynecology. He has received his medical degree from Western University of Health Sciences College of Osteopathic Medicine of the Pacific. So along with all of the requirements of an MD, Dr. Capetanakis has trained in the art of osteopathic manipulative medicine. He serves as the vice chair of the obstetrical and gynecological department at Scripps Memorial Hospital, Encinitas, and is a member of the American Congress of Obstetricians and Gynecologists. When not working, Dr. Cap enjoys spending time outdoors with his wife Angie and their 3 young children. He is an avid cyclist and has performed in numerous triathlons and bike rides. He also enjoys camping, hiking, soccer, and traveling. And also joining us today is Care Messer. Care is a founder of the Cap Wellness Center, as well as the founder and owner of the Birth Education Center and San Diego Hypnobirthing. She became a doula under the instruction of Jerry Ryan through Donna, and went on to become certified in hypnobirthing and has taught hypnobirthing since 2009. She is a certified hypnotherapist through NATH, and she's also a certified placenta encapsulationist. She trained with the ICEA to become certified as an international educator and trained with CAPA to be a postpartum doula. Care has taught natural birth training to student nurses at SDSU and holds a board position with the Nozzoni Institute of Midwifery. And until recently, she served as the vice president of the San Diego Birth Network. Care is the mother of 2 girls and 2 Pomeranians. Now let's switch over to the discussion with Dr. Cap and Care. Hello to you both.
Hello.
Hi.
And today's discussion is going to be around the importance of birth education. And so, Dr. Cap, I want to go right into the discussion around this. And why do you think education is so important for the women that are in your practice?
Yeah, it's kind of an interesting story. When we were pregnant, my wife and I, with our first, I'm a board certified OBGYN, and I was like, Angie, we should take a birth class. I really wanted to see what the birth classes were about outside of the hospital. And I really wanted my wife to understand the process. I mean, this was her first pregnancy. She wasn't very familiar with birth and the process. And so we actually took a hypnobirthing course. And the instructor was stating, you're the first OBGYN to ever take my course. And in my head, I was thinking, I'm probably the only OBGYN who's ever taken a course probably outside of the hospital. And so we did take the course. My wife got plenty of valuable information, and we did have unmedicated vaginal birth in the hospital for our first, and it was amazing. And it really opened up my eyes to viewing birth as a natural process, and it really opened up the possibilities of what a woman can do when she's empowered. So in my practice currently, we almost make it a requirement that you have to take a birth class. I mean, you really need to get educated. I mean, you're not going to run a marathon without training or learning about it. You're not going to do a triathlon without at least understanding what's going to be asked of you. And unfortunately, too many women, and I'm going to just do my air quotes, quote unquote, kind of wing it. And this is one of those situations where winging it might not give you all the tools necessary to trust your body and also have the trust that your partner is going to give you. Because remember, on the day that you go into labor, most of the time somebody's going to be with you. And if they have a role of a protector and taking care of you, it might be a little bit unnerving for them to see their loved ones in a little bit of discomfort. And getting to the hospital too early, we know does lead to more interventions, and that doesn't necessarily apply with my practice in general, but it's really about education. It's really getting the mom to understand the process along with her partner, to understand what's normal, to trust her body. I mean, I tell patients all the time, how come you can walk outside and you're barefoot and you step on a pine needle and you think, somebody cut your foot off, but yet you can dig out a splinter in your hand and not wince? It's about perception. It's about understanding what's going to happen so that you're better equipped for that challenge. And really, it's all about education. I mean, every patient should be taking education courses. CARE is going to talk a little bit about differences between hospital courses and the courses that are offered outside of the hospital. But it's important to know that those courses do vary. And saying, hey, I took a birth class at the hospital might not be the same as saying, I took a birth class outside of the hospital. And the differences can be monumental.
So, Kara, can you tell us about that Hospital Birth 101 class that is offered here and how that differs than what a woman might get from the hospital they're choosing to birth in?
Yeah, what I found with my own birth is the classes I got at the hospital were very standardized. They were kind of training me how to be a good patient and dictating how birth was going to go. There was really no how it really is. There was these stages of labor and the baby comes this way, and it was very uniform and almost sterile. And I was thinking, it's a human being coming out of my body to go into my arms. There's got to be more to this. And when we created Hospital 101, Dr. Cap and I assembled a really good team of educators, and we kind of laid out what do parents need to know for the simplicity of birth, because it's not complicated. And then how do we add the interventions if we choose, or the medications if we choose, at the end, when we know that's when we should, for an optimal labor experience, you should add them at the end. And how do we keep the partners and the moms connected in the beginning of labor, middle of labor, during labor, so that mom is more comfortable, so that the partner feels more of a sustainable help to her, that everybody in the room feels empowered. And so with the Hospital 101 class, it's a 3-week series followed by a one-time comfort measures class at the end. So you learn about the simplicity of birth, how your body works without medication, how it works when you add medication. We cover what inductions do, when is a good time to choose inductions or say yes to inductions, what happens when there's an unplanned medical emergency that arises, and how to stay calm and focused to make the right decisions for that baby. And then we also add the comfort measures class at the end. So with the comfort measures, you're going to learn how to stay home longer, add a doula, understand how the physiological part of birth works, keeping mom in a safe environment, low media, low lights, more touching, maybe the right music, all those different tools that doulas can provide to keep the partners connected. It's kind of like the lab for the coursework, and why we paired those two together.
Well, it really sounds like that course's focus is around options and information about options, I should say, rather than being laid out, this is how your birth is going to go. Exactly.
And we have set it up to be an intimate class. So we keep it at 7-8 couples instead of 15-20 couples. So the interaction between the teacher and the students is streamlined and intimate, so that we can ask any question we want about penises, vaginas, labor, butter births, whatever. And the visuals that we show are not fear-based videos. They're beautiful births, so that you have a replacement for all that negative stuff that you've seen on TV since you were 3.
And what other classes do you recommend pregnant women to take? I mean, we offer a wide variety here, but what ones would you highlight right now?
Well, we also offer hypnobirthing, which is a 5-week series, and we have a separate podcast on that, so I invite you to listen to that one. We also offer breastfeeding, newborn care, infant CPR, and a VBAC class as well. But the breastfeeding class is essential. I think if you're going to take any classes outside of the hospital, it's a breastfeeding class, as well as your childbirth education. And we recommend that you take that breastfeeding class 1 solid month before you have that baby, as well as attend a breastfeeding support group before that baby's even out. It makes a home base for you. You get to talk to a lactation consultant and see other moms and what they're going through with this new baby. It kind of brings it into focus for you, and also creates a home spot for you to come to after you have that baby, so that you have a safe, supportive place to start your journey with that new child.
And Dr. Cap, what would you say your experience has been now that you have these classes offered in the Cap Wellness Center with women that are more educated going into their delivery versus women that choose to, for whatever reason, not take as much education?
Yeah, I mean, we can show, not to talk about statistics, but I can tell you that the births that we do have with moms that have taken outside birth classes, whether that's with the center or not with the center, tend to get to the hospital much later in their labor course than moms who don't take birth classes, meaning that their cervix is dilating, they're contracting regularly. They tend to have more unmedicated vaginal deliveries, if that's what you desire from your birth experience. They tend to have less discomfort. They tend to have less C-sections. I know, statistically speaking, that moms that have taken our courses and have had births with a lower C-section rate than moms who haven't taken any courses. I don't know if that's because those moms without courses get to the hospital earlier, or they get epidurals more often. I don't want to make any assumptions on that, but that would be my feeling, is that they're getting to the hospital sooner. They're less prepared. They're getting epidurals earlier when they might not be in full-fledged labor, and they unfortunately tend to have more interventions because that labor then slows down or stops, and then we have to then talk about other options. So moms that do take our courses feel more empowered. They feel like they understand the system more. They feel like they understand their bodies more. They understand that this is a normal process. They don't have fear, and they tend to just have I don't want to say smoother births, but they tend to have births that go the way they would like and the way they desire when they're educated and empowered.
You can say smoother, because that's exactly what they have. And I wouldn't say it's flawless and it's pain-free, but I would say that the hiccups are less, and they can go with the flow of their birth better when they're educated.
Yeah, absolutely. I feel that the patients that have taken that education tend to feel better about their birth experience.
And one thing that they learn in any outside of hospital education class, I would hope, is that they understand the power of the cervix. The cervix operates on fear or love, and that's how it opens or stays closed, because it's protecting your young or allowing your young to come out into safety. And when we understand that that is a genetic, beautiful process that's been around to protect humankind for centuries, we understand that when we drop the fear and surrender into the beauty of birth, that our cervixes usually click right along, open up, and let our babies emerge safely, easily, and gently, and in a lot less time when we hold back because of fear and we're nervous about our surroundings, our partner, etc., that's what can prolong and make it more agonizing than it really needs to be.
And I think you just touched on an important point there that I want to reiterate, is that a lot of this education is for both mom and partner, right?
Oh, definitely. Your partner's going to be there with you through all of it. And I look at birth not as a marathon. I look at the pregnancy as the marathon, the ups, the downs, the, oh my gosh, can I get through this day? When it comes to actual labor, that's the finish line. And you want your best people at the finish line because it's short, it's sweet, and it's the ending. And that's the part that needs to be beautiful and magical. And you set it up during the marathon, but you finish off with the right team around you. And education is the way to do that.
Well, all of that sounds amazing. And I definitely think that anybody listening to this podcast would really hit home of how important education can be. And we have a wide variety of resources to do that. So definitely check out the podcast notes. Also our website at capwellnesscenter.com. It has all of the information about our upcoming classes, when they're offered, and how you can get involved. So again, Dr. Cap, Care, thank you again for sharing all of your wisdom and your information here.
Thank you.
All right, and we'll see each other again on another episode of Healthy Births, Happy Babies. Be well.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.